Good morning, and welcome to this week's episode of Ask Dr. Murphy. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well. Thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering a viewer-submitted question, addressing the latest headlines, and our lone U.S. COVID statistic through today, August 14th. We invite you to submit any questions or comments down below or at any of our social media linked in the description. Starting with that abbreviated COVID statistic, average COVID deaths per day in the last reported week were down to 22, and the same week in 2024, we saw 84 daily COVID deaths. Dr. Murphy, your reactions to those numbers, as well as the general state of COVID here in the US?
Well, the statistic you're reporting on is actually death. So death takes, once you get COVID, comes weeks or months later. And so that hasn't really changed. But what has changed is all the other markers that we now follow. We don't count cases anymore because too many of the cases are diagnosed at home with a kit they bought over the counter at the pharmacy, and you just never capture those. But you can look at emergency rooms, you can look at wastewater, you can look at some groups will report their hospitalization. So all those are going in the up direction. So this is the summer wave. The test, and also people coming in to get tested. What percentage are positive for COVID? That's another metric that's used. And the test positivity rate has increased from 6.5 to 8.6 over the past week. So that's a big increase. That's like, 30% increase. And levels are a little bit higher in the West and Southwest. And meanwhile, emergency department visits for COVID are rising for all ages. Overall, the level is up 19% in the last week. So it's out there. And that's all we know. There's a lot of COVID. If you have underlying diseases, have other illnesses, there's a treatment for COVID that's available, an oral pill that you just take it for 5 days. There's 2 options. And, so if you have some underlying risk, you should consider taking it.
Yeah, and one of the most vulnerable groups, that being very young children, may not be able to get the COVID vaccine this year or may have to jump through some hoops. Can you explain to us why?
Well, it's the Flat Earth Society. It has taken over some parts of the Department of Health and Human Services. The issue here is that the Pfizer mRNA vaccine, which was the first one that was approved in December 2020, it's been approved for kids 5 and older since 2021 and 6 months and older since 2022. And this week, the FDA announced that they're considering not renewing the approval for those under 5. This is very strange. The Moderna vaccine is approved for kids under 5, but only if they have a severe or some underlying health condition that puts them at higher risk. So for just kids in general under 5, it will no longer be available. The risk of severe illness and hospitalization in kids under 1 is comparable to that of adults 65 and older. They have immature immune systems. The older people, their immune systems are waning. And so this is precisely why young kids, their first exposure to COVID should be with the vaccine and not with the disease itself, not with the virus itself. And further, the CDC data among kids 6 months to 2 years who were hospitalized with COVID from October 2022 to April 2024, more than half of them had no underlying disease. So these kids are vulnerable, like over 65. You don't think twice about giving COVID vaccines to those people. And now they're considering not approving it for under 5. This is just very dangerous, and it's going to be really harmful for very young children in particular.
Mhm. And on the other side of COVID infection, looking into long COVID, there is some differing reporting on how prevalent long COVID really is. Now, there's some new research on why that might be. Can you break it down?
Yeah, long COVID, people have heard of long COVID. Everyone's heard of it. You probably know somebody who says they have long COVID. The rates of long COVID have ranged from as low as 2% to as high as 50%. And this is an analysis that's published in JAMA Network Open, very good journal. And they looked at 4,500 participants in studies of long COVID. And they found this gigantic range. But what they found was the definition for what is long COVID was different in all these studies. So it's not so much there's 2% or 50%, but it's actually what you're defining as long COVID. It has this kind of vague definition or definitions that not everybody agrees upon. So it's more how you define long COVID. If I get fatigued, a few times a week or something, is that long COVID? I don't know. But anyway, it looks like these studies show that part of the issue is just the definition of long COVID.
Mhm. And if we want to follow up on something we talked about last week and many weeks that's very important is changes in funding. We have a great question from a viewer who asked, can universities or these medical organizations, manufacturers that have lost this funding in these contracts go through any legal recourse to try to get it back?
Yes. I mean, they've been granted grants and contracts to do research studies, and they've just been taken away. Well, we're not interested in this anymore. Even though this had been vetted, approved, monitored, and involved patient care. And many groups like the American Public Health Association, several of the unions, and other groups have challenged these removals of the discontinuation of these grants, and in many cases they've won. Including we had a big one at Northwestern that was challenged, not by Northwestern itself, but by a group they were affiliated with, and it got reinstated. However, so many people have been fired or let go from the NIH. Reprocessing these grants now, it's not like you just can turn a switch on and it all goes back to normal. Plus, a lot of the people that were originally on the grants have now moved on because they got let go or laid off or fired, because there's no money for their projects. So it's causing a lot of confusion and delays getting these things up and running. But ultimately, they will. And hopefully, this is not going to happen again.
Mhm. It's like a broken glass. You could put it back together, but it'll take a lot of time and effort to
A
do
lot of
so.
time to put it back together.
Now, we often talk about the physical harms, the dangers, the mortality that can come from infectious disease and reckless public health decisions. Unfortunately, medical misinformation can be just as dangerous, and there was a big event last week that showed that. Can you just touch on it for a brief moment?
Yeah, it's a very sad story of a young man who has obviously severe mental problems, depression, and he was obsessed with thinking that his depression was caused by the vaccines. All right. And he loaded up some guns and went to the CDC and started widely shooting. He killed one police officer as a result. He shot a lot of bullets into the CDC. Fortunately, nobody else, very unfortunately, one person was killed. But I mean, it could have even been more devastating than it was. But and this is really all due. It's it's just so sad that this person's belief was supported by all this misinformation that these vaccines are causing depression and all that. They're not. There's been billions and billions of vaccines have been given, and they are really relatively safe. I mean, you take a risk every day when you walk down the street. You take a risk every time there's a lightning storm. There's a risk. There are just inherent risks, and the risk for the vaccines causing that are at that level. They're at a very low level. These things are intensely studied and followed, and it's just very unfortunate that this person, believed this misinformation and acted upon it in such a violent way. It's just very, very sad. And this is nothing new. The director of public health in Ohio was stalked and had people outside her house. She quit her job because she couldn't handle it. There were similar cases in California and other places around the United States of public health workers, being, assaulted, attacked, threatened. And there's no room for this. I mean, there's always room for debate. We can talk about what actually the risks are and whatever, but I mean, to resort to violence is just not the way it should go. Just historically, it's nothing new. In smallpox outbreak in Boston in the 17th century, they were just starting to use variolation, which is a form of vaccination for smallpox. And they thought it was like the greatest thing and recommended everybody get this. And there was an uproar that it's not God's way. We shouldn't be doing this. And the doctor who was promoting it, Dr. Boylston, had his house firebombed, and he actually left Boston and moved back to London. But anyway, I mean, so it's nothing new, but it's just very sad.
Yeah, and underscores just how dangerous this medical misinformation can
Right.
be for people. It's
Mhm.
really tragic. But coming back here to Chicago, there was a big announcement this week that the first three human West Nile virus cases have been reported and identified. Can you tell us about those cases and a little bit about West Nile?
Yeah, West Nile virus is another mosquito-borne illness. 70 to 80% of the people don't even get sick. However, 20% develop West Nile fever. Like they'll get a fever and feel badly and whatever. They don't know what they have. It's just a headache, sometimes a rash, some gastrointestinal symptoms. Less than 1% of the people with West Nile get encephalitis, can get really sick. We had some cases here in the past, ended up in the hospital. So they reported the first three cases in Chicago this year. Illinois has always been a big reporter of West Nile virus. They really looked very closely, so it's interesting to follow them. In 2002, Chicago established a mosquito surveillance and control program, and from June to October, with the big mosquito season. And if you look over just the last 4 weeks, the number of mosquitoes that they're collecting that have the virus it's usually over the last 4 weeks ranges from 8 to 18%. It has ranged now from 30 to 62%. That's a lot of infected mosquitoes. It's still high right now. Over 50% of the mosquitoes in Chicago or just about 50% have the virus in it. So it's pretty common. You want to avoid those mosquitoes. Same thing all around in this region, Western Michigan, Wisconsin, Indiana. So, be careful.
Absolutely. And as you noted, it's important to recognize that we've identified three cases. Those are likely symptomatic, but there are probably a lot more asymptomatic cases out there. So if you or someone around you gets very sick, consider that it may be West Nile.
Yeah, there's no treatment, however. There had been a vaccine. It was abandoned. Nobody wanted to take it. But I think just be careful. It needs to be on the radar screen of anybody who's feeling sick with a fever and a headache in particular.
Mhm. Now, a vaccine that should absolutely, excuse me, not be ignored is the measles vaccine. Could you give us a quick update on the status of this measles outbreak?
Well, it's still out there. It hasn't gone away. There's been 32 different outbreaks. The cases are climbing, not by leaps and bounds, but there's over 1,300 cases. So remember that in 2000, there were 0 cases when we had over 95% immunity from the vaccine. Nevada has finding it in the wastewater in Clark County, which is the big county that includes Las Vegas, although they haven't confirmed any cases in the city. So same thing in Idaho, they're finding cases. So and it's everywhere. So if that vaccine rate doesn't go up, this endemic, it may just be endemic. It may just be, we may just always be having measles cases.
Mhm. Something more common, unfortunately, than measles is pneumococcal pneumonia, something that you often hear about, but we don't talk about it that much. Now, it may be even more prevalent than we realize. Can you break down those numbers?
Yeah, so this was formerly a very common form of community-acquired pneumonia. It was bacterial, all right? And, years ago, the pneumonia vaccine was released. I can't remember the exact year, but quite a while ago. And that the number of cases went down. And so what's happened is they've improved the vaccine. So there are new improved pneumonia vaccines that are available. And they looked at these are researchers, again, reporting in JAMA Network Open, that looked at 2,000 patients who had pneumonia, and they found that 13.8% had pneumococcal pneumonia. And it was, if you extrapolate that to the entire population, it ends up that there's probably around 115,000 US hospitalizations for pneumococcal pneumonia per year. That's a lot of beds taken up by people who are sick, and a lot of people are very fragile, that are getting the pneumonia, and it can be life-threatening. So anyhow, this new vaccine, these new pneumococcal vaccines that are out there, do work against most of the strains. So it's advised that everybody who's at risk take this new vaccine, and it will help prevent them becoming a statistics in the 115,000 people that are hospitalized. It won't prevent it completely, but it will have a serious impact and good impact, significant impact on the amount of disease.
Mhm. Our next topic is also on a vaccine, but this is a rarer instance where new research shows that later in life, this vaccine for tetanus specifically may not be needed like it is early in life. Can you tell us about it?
Yeah, so everyone talks about they get tetanus or tetanus and diphtheria boosters every 10 years or so. And in a journal, Clinical Microbiology Reviews, they looked at the effect of these boosters. And the finding is that if you just focus just on tetanus, there more recently, there's been no deaths due to tetanus in the country. Very few cases, and most of those were people that had no vaccine when they were kids. If you had vaccines when you were kids, it looks like it's almost gone. So what they're proposing, and this is not a formal recommendation yet, is that in this case, the science is saying if you're an adult who had your childhood tetanus shots into adulthood, that you may not need any more boosters. So it's the science working the other way, saying you don't need another vaccine. So, why is that important? Well, if you're telling an entire population with 336 million or so people, to keep taking these boosters, and then all of a sudden you can say, hey, you don't need to take this one. That's like a lot of vaccine doses, and it can save a lot of money, and it looks like it might not be necessary. So we'll see if people accept that.
hmm Now, something I almost forgot to check in on because it's less common here in the Midwest, but more common over in New England, is that there is a spread of babesiosis. I don't know if I'm saying that correctly, tied to babesiosis. Thank you. Can you break down what that is for us and why we're talking about it?
Yeah, but we're talking about babesiosis in case you go to New England. All right. It's not here in the Midwest. Um, it's been noted to be in New England since the 1980s. It's a parasitic disease, sometimes referred to as North American malaria. It's spread primarily by a black-legged deer tick, which then infects the red blood cells and causes this flu-like symptoms, and in serious cases can lead to a hemolytic anemia and really very sick. So they found that over time, looking at the data here, that the number of cases increased from 2011 to 2019 by 193%. And this is primarily, that was 193% in Massachusetts, 338% in Connecticut, over 1,000% in Maine and Vermont. And the diagnosis showed a very strong correlation with each unit increase in time per year, with an annual growth rate of 14%. So what does that mean? There's more. Okay, so this is not a fantasy or anything. And it looks like the disease, it's a summer disease with the deer ticks, and that the season is getting longer. And that's most likely due to climate change. It's just a hypothesis, but there's more and more of it. So going to New England, you get sick like that, you have to think of yet another strange disease that you might get. It's treatable.
But always something to be looking out for. Our final story today is another thing to be looking out for, a log analysis for pregnant women and different antibiotics they may take during their first trimester and some issues that may come along with that. Can you break down the data?
Yeah, it's not really new data, but it's more data that shows that women who take antibiotics, particularly in the first trimester, do have an increased risk for fetal malformations. So, you want to avoid that. So anything in the first trimester, you have to be very careful with, all right? So they studied a group of 71,604 pregnant women, all right? And they looked at antibiotic exposure throughout the pregnancy, and particularly in that first trimester. A total of 1,518 infants had malformations. About half of them were cardiac, the heart, all right? So they looked at the major classes of antibiotics that they were exposed to, and they found a difference in the amount of malformations if they were exposed to those antibiotics. And so the one that had the highest rate of fetal problems was trimethoprim sulfamethoxazole, more commonly known as Bactrim or Septra. It's the sulfa drug, very commonly used to treat urinary tract infections and some other infections, but mostly urinary tract infections. They also looked at fluoroquinolones, nitrofurantoin, and the beta-lactams that are out there. These are just different categories of drugs. And the trimethoprim sulfa drugs were higher than all the other ones. And those exposed to trimethoprim sulfa had about 2 times the risk for severe cardiac malformations, and for cleft lip and cleft palate, about 3 times greater than if they were not exposed to it. So it's all relative. It's not an absolute number, but it does increase the risk. I just thought it was an interesting thing. It's just, before people just throw antibiotics out there, a lot of times in the first trimester, women don't even know they're pregnant yet. So, we just have to just keep it in the back of our minds.
Absolutely. Something to consider, like you said, these are still malformations are still rare overall.
Mhm.
Why take the chance? Might as well reduce that risk.
Yeah,
And on that note, I'd like to
the
thank
thing
you,
about
Dr. Murphy.
antibiotics, though, is you may need the antibiotic. I mean, because being sick with some kind of bacteria also is not good during pregnancy. So, it's always a risk-benefit ratio.
Absolutely. And is the doctor medical advice? I would absolutely follow Dr. Murphy before you listen to anything that I say. And on that note, I'd like to thank you for breaking all this down for us and helping us understand all the data. Much appreciated.
Well, great. Thanks, Katie.
And thank you all for joining us for this week's episode of Ask Dr. Murphy. Hope you enjoyed. Again, if you have any questions or comments, please leave them down below or at any of our social media linked in the description.